Good morning, everyone. Today, let's step into one of the most vital and honestly fascinating fields in all of medicine, anesthesia. Now, most people think anesthesia just means putting patients to sleep. But actually, it's about much more. Managing pain, maintaining vital functions, and ensuring patient safety, especially during surgery and critical care. So, what exactly is anesthesia? It's a state where sensation or awareness is temporarily controlled. There are 4 main types. General anesthesia means total unconsciousness. Regional anesthesia numbs a large area, like when we do a spinal or epidural. Local anesthesia is focused on a small area, and then there's sedation, where the patient is relaxed but still conscious. What do I aim for when I anesthetize a patient? 5 main goals. Amnesia. They shouldn't remember anything. Analgesia. No pain. Areflexia. Muscles are relaxed. Anxiolysis. Anxiety is reduced. And finally, autonomic stability. I have to keep their heart rate, BP, and other vital signs steady. I use a variety of drugs to achieve this. Induction agents like propofol and thiopentone help patients drift off. Inhalational agents such as sevoflurane keep them under. Muscle relaxants. Think succinylcholine and rocuronium. Opioids like fentanyl for pain. And reversal agents like neostigmine to bring them back. Don't worry. We'll go deep into each of these in future sessions. The anesthesia machine is my best friend in the OT. It delivers gases, monitors vitals, and keeps everything safe. It's got vaporizers, flow meters, CO2 absorbers, breathing circuits, and monitors for ECG, SPO2, and BP, all working together. But before I give any drug, pre-op assessment is vital. History, comorbidities, allergies, checking the airway, even using things like the Malampati score. Don't forget ASA grading and baseline investigations like CBC, ECG, X-ray. Never skip this step. It can literally save lives. Now, complications can and do happen. Hypotension, laryngospasm, aspiration, malignant hyperthermia, or even awareness during anesthesia. So I always prepare and anticipate. That's the real art of anesthesia. Let's make it practical. Imagine a 45-year-old male, hypertensive, coming for elective hernia repair. Which anesthetic technique would you pick and why? Think about it, and we'll discuss. Remember, anesthesia is safe when you plan well. Always assess your patient, know your drugs and equipment, be ready for complications, and work as a team. In our next session, we'll dive into one of the most crucial skills, airway management. Any questions? Thank you so much for joining in.